Today, we are going to discuss the 5 most common mistakes that people make with low back pain. If you've been suffering with low back pain for more than a week, I definitely recommend checking out this video, seeing if any of these fit you, so you know quick changes that you can make to decrease your low back pain. Mistake number 1, sleeping on your stomach. So many of my patients are continuing to sleep on their stomach even when they have low back pain or even neck pain. Now, I've definitely got to say that it's worse for your neck to sleep on your stomach, but it is not great for your low back. You really need to be in a side sleeping position or even sleeping on your back. Now, if it's difficult for you to change your position and you're like, Dr. Amy, there's absolutely no way I can go to sleep without sleeping on my stomach, then I ask that you at least put a pillow underneath your stomach to help open up those joints. When you sleep on your stomach, it causes the joints in your low back to become compressed, which gets irritated over time because hopefully you're sleeping for few hours every night, and then you wake up feeling stiff and sore and achy. So if you cannot get away from sleeping on your stomach, then I'm going to ask that you put a pillow underneath your stomach so that at least it helps keep those joints open and will decrease the inflammation that you feel in the morning. Mistake number 2 that I see people making is not extending. Now, extension is when you're bending backwards, and you may say, oh, that does not seem like it would feel good. And I understand that point. However, extension is a normal activity. Now, I am not saying that you should start going and doing back bends like an Olympic gymnast, but you do need to have that mobility available. I was recently talking with a patient who was told when she went to PT 10 years ago that she should tuck her tail when she was walking, so it would kind of tuck underneath her. And I admit, 10 years ago in PT, when I went to PT school, it was more than 10 years ago, that's how we were told to tell people to walk. Now, the research clearly indicates that that does not make sense, and that extension is a normal activity. Now, as with any activity, if it's painful, I definitely recommend you avoiding it. So I'm not asking you to do something that is painful, but I am asking you to use your available range of motion, and don't fear that motion just because you're concerned that it's going to be painful. Check it out. Do it in a very gentle way. Again, no Olympic back bending here, but just getting so you're in a position where you're standing up nice and straight or sitting up nice and straight without getting too much tension on your low back. Mistake number 3 I see is that they don't understand that motion is lotion. I know it sounds trite, but it goes along with mistake number 2. You have got to keep as much motion as you have pain-free in your low back in order to allow all the tissues to heal. One of our favorite sayings around here, and our number 1 core value, is movement is life, because every tissue in your body is designed to heal itself as long as it's moving correctly. Mistake number 4, assuming that hurt equals harm. Now, I'm not talking to you right now if you've only had low back pain for a week or 2. Right now, I'm talking to the people who have chronic low back pain. What can happen is that over time, our signals can start to misfire. So think of it this way. When something goes wrong with your car, your dashboard lights up and your check engine light comes on. And of course, you need to deal with that immediately because you don't want to have something go horribly wrong with your car or your engine and be stuck on the side of the road. Here's the caveat. With chronic pain, sometimes the check engine light goes off when there's nothing wrong with the car. It's that the system is not properly responding to the signals that's being sent. Now, if this is you and you're not sure how to listen to the signs of the dashboard anymore, you need to find a specialist who is able to help you learn when you are getting into a pain that is damaging and causing harm situation versus when you are getting abnormal signals. And I know that this is super controversial and it's super difficult to walk that line. I 100% get it, but we need to make sure that we're able to define the difference between tissue damage and abnormal signals, especially if you have chronic pain, because your brain gets rewired and these superhighways get formed that are automatically going to respond in a very specific way. But that doesn't necessarily mean that that way is authentic to your body anymore. there may have been some tissue damage that started this process in the first place. And it could be that there's some maladaptive behaviors that are causing it to continue. However, this needs to be addressed by working with a specialist who can look at all the different aspects to make sure that you're getting the best treatment for you. Mistake number 5 that I see people making is not training to stay out of pain. It is really important to make sure that once you get that tissue healed that was causing that pain in the first place, that you train for what you want to do. So it could be anything. It may be your job, it may be hiking, it may be biking, it may be running, but you need to make sure that you're not going to damage that tissue again, especially if it's one of those activities that caused the damage in the first place. You need to work with a specialist who is going to understand your goals and be able to train you to get you back to where you want to be. All right, there it is, the top 5 mistakes I see people making with low back pain. If you'd like to learn more about this, I'm going to drop a link below to my book, Movement is Life, where we discuss not only these mistakes, but what you can do about them. Have a great day, everyone.